CEN Exam Prep 8th Edition. Question 1. A patient presents with severe right upper quadrant pain radiating to the right shoulder, nausea, and vomiting. The nurse anticipates a diagnosis of Option A, acute pancreatitis. Option B, acute cholecystitis. Option C, peptic ulcer disease. Option D, gastritis. The correct answer is option B, acute cholecystitis. The classic presentation of acute cholecystitis is severe right upper quadrant pain radiating to the right shoulder or back, Care's sign, along with nausea and vomiting. Acute pancreatitis, A, pain is epigastric and radiates to the back. Peptic ulcer disease, C, is epigastric pain. Gastritis, D, is epigastric burning or pain. Question 2. A patient with suspected stroke has a blood pressure of 190/110 mmHg. What is the appropriate nursing action? Option A, administer 4-labetalol to lower blood pressure. Option B, administer 4-hydralazine. Option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. Option D, administer a nitroprusside drip. The correct answer is option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. In ischemic stroke, elevated blood pressure is often compensatory to maintain cerebral perfusion to penumbral tissue. Current guidelines recommend against lowering blood pressure unless it is extremely high, greater than or equal to 220/120, or the patient is receiving thrombolytics. This patient does not qualify for intervention yet. Options A, B, and D are not recommended unless criteria are met. Question 3. A patient presents with abdominal pain, vomiting, and a blue-gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue-gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with a urinary tract infection presents with confusion and fever. What is the most likely diagnosis? Option A, uncomplicated UTI. Option B, pyelonephritis. Option C, urosepsis. Option D, interstitial cystitis. The correct answer is option C, urosepsis. Confusion and fever in a patient with a UTI, especially in an older adult, suggests urosepsis. This is a life-threatening infection requiring immediate intervention. Uncomplicated UTI, A, does not cause confusion. Pyelonephritis, B, causes flank pain, fever, and chills. Interstitial cystitis, D, causes chronic pelvic pain. Question 5. The nurse is caring for a patient in cardiogenic shock following an ME. Which hemodynamic parameter is expected? Option A, elevated CVP, elevated PCWP, low cardiac output. Option B, low CVP, low PCWP, high cardiac output. Option C, elevated CVP, low PCWP, high cardiac output. Option D, low CVP, elevated PCWP, low cardiac output. The correct answer is option A, elevated CVP, elevated PCWP, low cardiac output. Cardiogenic shock is characterized by pump failure, leading to elevated filling pressures, CVP and PCWP, and reduced cardiac output. Options B and C describe distributive shock, such as sepsis or neurogenic shock. Option D is not consistent with any shock pattern. Question 6. A patient presents with agitation, confusion, and is hyperthermic after ingesting a street drug. The patient's pupils are dilated, skin is dry, and the patient is tachycardic. What is the most likely drug involved? Option A, cocaine. Option B, methamphetamine. Option C, anticholinergic drug, example PCP. Option D, ecstasy. The correct answer is option C, anticholinergic drug, example PCP. The anticholinergic toxidrome is characterized by red as a beet, dry as a bone, hot as a hare, blind as a bat, mad as a hatter, flushed skin, dry skin, hyperthermia, mydriasis, dilated pupils, and delirium. Cocaine, A, and methamphetamine, B, cause tachycardia but also diaphoresis and constricted or dilated pupils depending on the stage. Ecstasy, D, can cause similar symptoms but typically also includes diaphoresis. Question 7. A 12-lead ECG has been completed on a patient who presents with chest pain. The ST segment is normal. Which new finding is most critical and requires prompt intervention? Option A, left bundle branch block. Option B, right bundle branch block. Option C, peaked T waves. Option D, inverted T waves. The correct answer is option A, left bundle branch block. New-onset left bundle branch block, LBBB, in a patient with chest pain is a critical finding that can mask acute ST-segment elevation myocardial infarction, STEMI, on ECG. The presence of new LBBB with chest pain is considered a STEMI equivalent and warrants immediate reperfusion therapy. Right bundle branch block, B, is less concerning and often benign. Peaked T waves, C, may indicate hyperkalemia but are not as immediately critical as new LBBB in this context. Inverted T waves, D, can indicate ischemia but do not necessitate the same urgent intervention as new LBBB. Question 8. A patient refuses treatment and wants to leave the ED against medical advice. What is the nurse's priority action? Option A, let the patient leave. Option B, notify security. Option C, assess the patient's decision-making capacity. Option D, restrain the patient. The correct answer is option C, assess the patient's decision-making capacity. If a patient wants to leave AMA, the nurse must first assess whether the patient has the capacity to make informed decisions. If the patient is alert, oriented, and understands the risks, they have the right to refuse care. Notifying security, B, is only if the patient is a danger. Restraints, D, are not appropriate for a patient with capacity. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with cirrhosis presents with hematemesis. What is the most likely source of bleeding? Option A, peptic ulcer. Option B, esophageal varices. Option C, gastritis. Option D, a Mallory-Weiss tear. The correct answer is option B, esophageal varices. Patients with cirrhosis develop portal hypertension, leading to esophageal varices. These are fragile and prone to bleeding, causing hematemesis. While peptic ulcers, A, gastritis, C, and Mallory-Weiss tears, D, can also cause upper GI bleeding, esophageal varices are the most likely source in a patient with cirrhosis. Question 10. A patient is diagnosed with a UTI and prescribed nitrofurantoin. What is an important patient education point? Option A, take the medication with milk. Option B, complete the entire course of antibiotics. Option C, the medication may turn the urine bright orange. Option D, avoid foods high in tyramine. The correct answer is option B, complete the entire course of antibiotics. Completing the entire course of antibiotics is essential to prevent recurrence and antibiotic resistance. Nitrofurantoin should be taken with food, not milk. A, it may cause brown or rust-colored urine, not bright orange. C, tyramine avoidance, D, is important for MAOI medications. Question 11. Which of the following is a classic sign of a hip fracture in an older adult? Option A, internal rotation of the affected leg. Option B, shortening and external rotation of the affected leg. Option C, adduction of the affected leg. Option D, flexion of the affected leg. The correct answer is option B, shortening and external rotation of the affected leg. A hip fracture typically presents with the affected leg shortened and externally rotated. The patient is unable to bear weight. Internal rotation, A, is more common in hip dislocation. Adduction, C, and flexion, D, are less specific findings. Question 12. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A, perform a 12-lead ECG. Option B, obtain vital signs. Option C, administer aspirin. Option D, assess the chest pain. The correct answer is option B, obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Question 13. Which finding in a patient with pneumonia would indicate the need for ICU admission? Option A, respiratory rate of 24 breaths/min. Option B, altered mental status. Option C, temperature of 101.5 degrees Fahrenheit. Option D, WBC count of 15,000. The correct answer is option B, altered mental status. Altered mental status in a patient with pneumonia indicates severe illness, possible sepsis, or hypoxemia, and warrants ICU-level care. A respiratory rate of 24, A, is mildly elevated and can be managed on a medical floor. Temperature of 101.5 degrees Fahrenheit, C, is common with pneumonia. WBC of 15,000, D, is elevated but not indicative of ICU need by itself. Question 14. A patient presents with signs of hypothermia. Which core temperature indicates severe hypothermia? Option A, 32 degrees Celsius. Option B, 30 degrees Celsius. Option C, 28 degrees Celsius. Option D, 26 degrees Celsius. The correct answer is option C, 28 degrees Celsius. Severe hypothermia is defined as a core temperature below 28 degrees Celsius (82.4 degrees Fahrenheit). At this temperature, the patient may be unconscious with minimal or absent vital signs. Mild hypothermia, 32-35 degrees Celsius, A, moderate, 28-32 degrees Celsius, B, and severe, 28 degrees Celsius, C. Option D, 26 degrees Celsius, is also severe, but 28 degrees Celsius is the threshold. Question 15. A patient is experiencing a tension pneumothorax following chest trauma. The nurse anticipates which intervention? Option A, needle decompression at the second intercostal space, midclavicular line. Option B, needle decompression at the fifth intercostal space, anterior axillary line. Option C, chest tube insertion at the second intercostal space, midclavicular line. Option D, supplemental oxygen and observation. The correct answer is option A, needle decompression at the second intercostal space, midclavicular line. Tension pneumothorax is a life-threatening condition requiring immediate needle decompression. The needle should be inserted at the second intercostal space in the midclavicular line on the affected side. This releases trapped air and relieves pressure on the heart and great vessels. The fifth intercostal space, B, is for chest tube insertion. Chest tube insertion, C, is the definitive treatment after needle decompression. Question 16. A patient is receiving packed red blood cells. 15 minutes into the transfusion, the patient reports chills, flank pain, and shortness of breath. What is the nurse's priority action? Option A, slow the infusion rate. Option B, stop the transfusion immediately. Option C, administer diphenhydramine. Option D, notify the provider. The correct answer is option B, stop the transfusion immediately. This patient is experiencing signs of a possible transfusion reaction, chills, flank pain, dyspnea. The immediate priority is to stop the transfusion, keep the 4-line open with normal saline, and notify the provider. Slowing the infusion, A, does not stop the reaction. Diphenhydramine, C, may be given but after stopping the transfusion. Question 17. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A, administer 4 lorazepam. Option B, assess for head injury. Option C, obtain a stat CT scan. Option D, perform a detailed neurological assessment. The correct answer is option A, administer 4 lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates. Question 18. A patient is bitten by a venomous snake. What is the priority nursing action? Option A, apply a tourniquet above the bite. Option B, immobilize the affected limb. Option C, administer antivenom immediately. Option D, incise and suction the wound. The correct answer is option B, immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with stridor and drooling. What is the priority nursing action? Option A, assess the airway and prepare for possible intubation. Option B, obtain a lateral neck X-ray. Option C, administer nebulized epinephrine. Option D, administer 4 antibiotics. The correct answer is option A, assess the airway and prepare for possible intubation. Stridor with drooling in an adult suggests epiglottitis, a life-threatening airway emergency. The priority is to secure the airway. The patient should not be agitated or have a throat examination. Lateral neck X-rays, B, may delay care. Nebulized epinephrine, C, may be used for croup but is not appropriate for adult epiglottitis. Antibiotics, D, are important but secondary to airway management. Question 20. A patient presents with sudden onset of severe, diffuse abdominal pain that is like a knife. The patient is lying very still. This presentation is most consistent with Option A, acute pancreatitis. Option B, perforated ulcer. Option C, renal colic. Option D, bowel obstruction. The correct answer is option B, perforated ulcer. A perforated ulcer typically presents with sudden, severe, diffuse abdominal pain described as knife-like. Patients lie perfectly still because any movement worsens peritoneal irritation. Acute pancreatitis, A, is often severe pain but more epigastric and often radiates to the back. Renal colic, C, is flank pain. Bowel obstruction, D, is cramping pain with nausea and vomiting. Question 21. Which laboratory finding is most specific for acute myocardial infarction? Option A, elevated creatine kinase -MB, CK-MB. Option B, elevated troponin I. Option C, elevated myoglobin. Option D, elevated C-reactive protein. The correct answer is option B, elevated troponin I. Cardiac troponins, troponin I and T, are the most specific biomarkers for myocardial injury because they are found exclusively in cardiac muscle. Troponin I is not found in skeletal muscle, making it highly specific for myocardial infarction. CK-MB, A, is elevated in cardiac injury but can also be elevated with skeletal muscle damage. Myoglobin, C, is early but nonspecific. CRP, D, is a marker of inflammation and is not specific for me. Question 22. Which of the following is a contraindication to the use of continuous positive airway pressure, CPAP, in a patient with respiratory distress? Option A, COPD exacerbation. Option B, hypoxemia. Option C, confusion or inability to protect the airway. Option D, mild asthma exacerbation. The correct answer is option C, confusion or inability to protect the airway. CPAP requires a patient who can protect their own airway. A confused patient or one with an unprotected airway is at risk for aspiration and should not receive CPAP. COPD exacerbation, A, is an appropriate indication, as are hypoxemia, B, and asthma exacerbation, D, with caution. Question 23. A patient with a known history of diverticulitis presents with fever and severe left lower quadrant pain. Which assessment finding is most concerning? Option A, abdominal guarding. Option B, rebound tenderness. Option C, rigid, board-like abdomen. Option D, a flatulence. The correct answer is option C, rigid, board-like abdomen. A rigid, board-like abdomen in a patient with diverticulitis suggests perforation with peritonitis, a surgical emergency. Abdominal guarding, A, and rebound tenderness, B, are also signs of peritoneal irritation but are less severe than board-like rigidity. Flatulence, D, is not concerning. Question 24. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is? Option A, tracheal intubation. Option B, 4 fluids. Option C, needle cricothyrotomy. Option D, pleural decompression. The correct answer is option C, needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. 4 fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 25. A patient with acute ischemic stroke arrives at the ED 2 hours after symptom onset. Which question is most important for determining eligibility for thrombolytic therapy? Option A, what is the patient's blood pressure? Option B, what time were the patient's symptoms last known to be normal? Option C, does the patient have a history of hypertension? Option D, what is the patient's family history? The correct answer is option B. What time were the patient's symptoms last known to be normal? The time of last known normal is the most critical factor for determining eligibility for thrombolytic therapy with TPA. The window is up to 4.5 hours for select patients. Blood pressure, A, is also important, but the time window is the primary determinant. History of hypertension, C, is relevant but not as critical.